Another example of what I call sometimes the invisibility of nursing work, and what I, we talk about failure to rescue, but what I wish we talked more about, and I think it's getting in the literature a little more in the literature now, is the rescuing that's going on all the time, but invisible to everyone. One of the nurses we followed in our studies was just an expert, excellent nurse. So I followed her around and was observing her do her work that day. She had 5 patients, all of them very complex, but that reflects everybody on our med-surg and ICU units now. And she also had a tech with her for those patients who was a student nurse. And so this person likes to teach, so when she could, she would also teach her. Now this student nurse also was a tech with another RN. So there were 2 RNs, each with about 5 or 6 patients, and they shared this tech. So I'm following the nurse around, and she goes into the room where she has just delegated to the student nurse to get a patient up out of bed for the first time, and this was a surgical patient with an abdominal wound. And I follow my nurse that I'm observing in there, and she goes in and she talks to the patient, sees that the student is getting the patient, is starting to get the patient up. And as they get the patient up, about halfway, the patient says, "I'm not feeling very well at all." And immediately, this experienced nurse lays the person back down, kind of just stands there for a second and stares at her, puts her oxygen, her nasal cannula back on, and adjusts the oxygen. And she checks her blood pressure, takes out her stethoscope and listens, and went through a whole series of things, and then she tells the student, let's wait a little bit, and then we'll maybe think about getting her up a little later. But in the meantime, goes and gets an O2 saturation monitor, checks out her O2, it was a little low, adjusts the oxygen again. We went to go see a couple of her other patients, which were needing a lot of care, but she never spent more than 5 to 10 minutes and went right back to this other patient. And of course, me, being the nurse who's been a nurse now for 30 years by now, but has not actually worked on a surgical unit as a staff nurse for many of those years, am thinking, because I thought I was a pretty good staff nurse, I thought, somebody who has surgery for the first time, you have to kind of coax them a little bit. And they're not real eager to stand up and get up, and so you kind of have to coax them and urge them, and but she just completely shut down getting her up and really was focused on other things. So I thought, okay, that's where I'm going with the interview. Talk to me about what you were thinking, that you didn't do what I would have thought something you would have done. So we get in the interview, and I said, okay, talk to me about, you go to get this patient up, first time up, abdominal surgery, and all the little person said was, I don't feel very well, and you immediately put him back down. Now, and I told her my old nurse story, and we had to coax them and all that. Talk to me about what you were thinking when you were in the middle of it. And she says to me, well, she did look a little pale to me when she said, I don't feel very well. And then what it really was, she says? I'd been in the room an hour before, and we were turning the patient from side to side. She was cooperative, she was cheery, she had no problem turning, she participated like everything, but one little raise of the head and movement, and she said, I don't feel very well. And it wasn't pain, because I had checked with her if she was having pain. And so I thought to myself, wow, she's not a whiner. What's this about? And so I asked her, what's a whiner? And she says, no matter what you do, no matter what you try, they're just a person who that's their response to being ill or sick, or if they're in pain, is to, do the little behaviors of whining, which is fine, but that wasn't what I saw an hour before. So she said, so I'm thinking pulmonary embolism, I'm thinking she's thrown a clot of some kind, and I just needed to get a handle on that. She says, I tried to talk to her to see if it was just anxiety, you know, if it wasn't the O2 sat or vital sign issues that demonstrated a clot or something. So I just needed to watch her a little bit more and just kind of keep in tune. So that amazed me right there. That convinced me that nurses aren't about going in, doing an assessment, and that is a linear fact out of relation to everything else. It is in relation to everything else, right? It's the complex adaptive system of the nurse putting together what they see now with what they heard before, and all of it forming a pattern, or all of it being a contrast or a compare, constantly picking up cues. So that was important for me to see and learn.